Carsten lives with his HS for 11 years before he is diagnosed correctly. He chooses to quit his dream job as a chef because he thinks that the illness might be contagious, and instead he works at night, where he can hide with his illness. To start with, the medical consultations all too often end up with two useless results: prejudice and antibiotics. Carsten discovers the first signs of HS while he's working as a chef. He bleeds from under his armpits, and he thinks to himself, it's no good having abscesses under the armpits when working in this profession. Carsten is embarrassed by his abscesses, so he doesn't tell anyone about them. People with HS feel that it is an unworthy disease. The truth is, however, that the treatment is the unworthy part. Carsten finally overcomes his shame of the abscesses under his armpits and visits his GP, the general practitioner. The GP doesn't know about HS and tells Carsten to go home, wash, quit smoking, and prescribe some tablets to treat the condition. In one area, HS is different from other conditions or disorders. It is a disease where the patient is met with prejudice from the healthcare professionals. Carsten feels like a pawn in the healthcare system. He feels isolated and rejected. The treatment he receives is useless. Carsten lacks knowledge, understanding, and direction. And he thinks to himself, next time I will drain the abscesses myself. HS patients experience that they have to talk to many people who know very little, and would prefer to talk to a few specialists who know a lot. Carsten's quality of life is going downhill. He feels that his wish to socialize with the opposite sex is out of the question. The physical pain is unbearable, and friendships fade away after an incident when Carsten's abscesses burst and left bloodstains on the sofa in a friend's house. It is often seen that the feeling of powerlessness makes HS patients resort to treating themselves. The heartbreaking truth is they often try to cut and drain the pus from their abscesses instead of going to their GP. At the dermatological department, Carsten finally meets a doctor who knows about HS, and he is offered the correct treatment. Carsten is serene and relieved. There is hope. There are others with HS. He is not alone. Most HS patients become exalted when they receive a correct diagnosis and learn that they are not alone with their symptoms. Carsten meets a team at the dermatological department. They understand him and listen to him when he shares his knowledge of his own disease. One could say that after a long and winding journey through the system, he is finally in treatment. The dermatological department doesn't only treat the patients, they consult them. Carsten tells his new doctor about his experiences since he first discovered his abscesses. The doctor shares his knowledge of HS with Carsten. The cooperation they have about his treatment enables Carsten to feel that he is making an important contribution by helping himself and others with HS. Empathy is not only showing compassion, it is also the beginning of a physical and healing process. From having been afraid of his unknown disease and feeling guilty about his abscesses, there is now a continuity in Carsten's treatment. He is one of many. Through the Patient Association, HS Denmark, he can share his knowledge and support others with HS, as well as being supported himself. When the disease that is in question not only weakens your health, but is also perceived as directly insulting and degrading for the patient, the person treating the patient must have sensitivity and tact. They must tread very carefully. There is rarely just one cause for HS. Usually there are many causes. Therefore, the optimal treatment must be widespread. When treating the HS patient, it is essential that the healthcare professionals collaborate on all areas and aspects of both the treatment and care, respecting the fact that all their actions have great significance in the treatment of the HS patient. This collaboration must have the patient at its centre. This film is developed by the Patient Association, HS Denmark, in cooperation with Roskilde Dermatological Department.